There we go. Give everybody a few minutes to jump on. They're adding up quickly. Hi, everybody. Happy December. Hope everybody's healthy and well. We are trying new things today. Our wonderful presenter today is, we've got faces attached to presentations today. So nothing like switching it up the last month of the year. Right, Annie?
That's right. Let's do it.
Let's do it. Okay, everybody, we're going to go ahead and get started. We got a lot to go over. First off, welcome to the very last webinar of 2020. We certainly appreciate all of your support this year, and we'll look forward to a great webinar series next year. Details coming up soon. Today's presentation is the triple pandemic, how NAATP is helping providers fight racism, COVID-19, and addiction. And our wonderful presenter today is Annie Peters. She is the Director of Research and Education at the National Association of Addiction Treatment Partners. We're going to go over a few things here. As far as Harmony Foundation, we're nestled on a 43-acre campus up in the Rocky Mountains in Estes Park near the Rocky Mountain National Park. We are a residential rehab. We have been in business for over 50 years treating addiction. We are a 70-bed residential treatment program. We offer a detox program, full detox program, residential treatment, and we now have an IOP program. And if you're looking for any additional information, please feel free to visit our website. It's listed at the bottom, harmonyfoundationinc.com, or feel free to call our admissions staff, 866-686-7867. I've been over this information. I'm sure most of you are tired of me repeating the same stuff. So if you have any questions, please feel free to reach out. I'll be happy to answer them. A few housekeeping rules that I'll go over is we will be sending out an online evaluation afterwards. I would really appreciate your feedback. I do read it every month, and I certainly try to find presenters that will cover the topics you're requesting. So if you'll continue to do that, I would appreciate it. Also, you can let me know what you think of the live presenter on the side this month. We'll get some feedback there. We will send your certificate by email by end of day on Friday. If you do not receive it, please feel free to reach out to me at the email listed on the screen, and I'll be happy to help you out. These webinars are recorded. I will have it posted on our website. Probably by end of day Friday as well. So if you have to jump off, you can catch up later on the website. As far as the certificate, you must be engaged in the webinar at least 45 minutes in order to receive your certificate. We do monitor that. So if you do have to jump off and you don't make that 45 minutes, I can give you a certificate of attendance. Just email me and let me know. So as we go on here, I would like to say thank you to NAATP for their continued support. They are a wonderful organization. I highly encourage you to visit their website to learn more about them. It's listed on the screen at www.naatp.org. And with that, I'm going to introduce our wonderful presenter, Annie Peters. Again, she's the Director of Research and Education at NAATP, leading the national effort to further understand substance use disorders through collaborative quality improvement and research. Dr. Peters is a clinical psychologist who completed her doctorate at the University of Colorado in Boulder. She has been working in the addiction treatment field since 2006 with experience in assessment, psychotherapy, process improvement, compliance, counselor education, and clinical leadership. And I'm so excited she's here. So I'm going to stop talking and let Annie get started.
All right. So I'm now sharing my screen. Oops. Give me 1 second. I need that and that. Oops. Failed to start. Let me try again. Sorry about this.
No, it's okay. We love virtual world.
So, oh, I can do this. Okay, there we go. We're all ready.
Right on. I'm going to
Okay.
jump out.
Okay. Thank you, Christy. Hello, everybody. As Christy mentioned, I'm Annie Peters, the Director of Research and Education at NAATP. So if you don't know who NAATP is, we've been around for about 40 years. We are a membership organization that has about 1,000 addiction treatment providers as members. Harmony is one, so I'm glad to be here for a Harmony webinar. I love Harmony. What NAATP does is we support the leaders and the staff of the addiction treatment provider organizations that are our members, trying to help them with ethical practice, quality care, leadership guidance. And this has certainly been an interesting year to support addiction treatment providers because providers are worn out and tired. This has been a very challenging year for everyone. And there's a lot more substance use that's happening now, which I'll talk about a bit. You know, when I thought about the title of this presentation, which will likely be a similar title to NAATP's national conference, which is in May, which hopefully will be in person. We're going to have a similar topic for the entire conference. So doing, even touching on this in less than an hour will be quite a challenge. But, you know, I really wanted to speak about how we're all doing and how we can support each other. You know, I'm sure many of you are in addiction treatment or mental health providers. And so, you know, how can we help each other and help our patients to get through this challenging time. So there we go. So these are the objectives. I'm going to talk a little bit about the impact of COVID. I'll mention first, of course, the addiction crisis we've been in for a long time, and also the role of systemic racism in disparities in both COVID healthcare and addiction healthcare. And then some ways that we're trying to help our members and to help allow for some systemic change that will really support provider members as much as we can to support the people to whom they provide their services. So we're all familiar, likely, with the addiction epidemic, which is a common term that's used, and probably the way we've heard it the most is of the opioid epidemic, which of course over the years has happened in a number of waves around prescription opioids and heroin, and then synthetic opioids, specifically drugs and medications that have been that fentanyl has been added to, has caused, you know, almost 500,000 deaths since, as it says, 1999. Now, of course, there's, you know, when we talk about the opioid epidemic, we're not talking about alcohol and other drugs, which still are very lethal. In fact, alcohol remains even a bigger problem than opioids in its impact on health and families and communities. But as I'm going to be talking a little bit about systemic racism, you know, when we talk about the opioid epidemic, in how we talk about that, and even that being a more common term than the alcohol epidemic or the cocaine epidemic, there's some elements of systemic racism in how we speak about this epidemic, because if you think about in the early 2000s, where the media was you know, kind of had a fascination with opioid use, particularly in white, mid or upper class community, and a number of celebrities who died from an overdose. Oh, are you there? Am I there? Okay, am I still there? Can you hear me? Oh,
I had lost internet. I do apologize.
Oh, no worries. Okay, but you can still hear me. Okay. So to some extent, the discussion of the opioid epidemic did destigmatize addiction to an extent, because there was a lot of talk about it, this epidemic affecting everyone, but it was much different from the media portrayal of the war on drugs. If you think about the crack cocaine use among Black communities in the 80s, that, people from white communities were called victims of the opioid epidemic, while the Black Americans, when we talked about the crack cocaine, was more talk about dangerous criminals. And so it's very different in how we talk about addiction. But overall, we know that this is a problem that has persisted for a long period of time and is only getting worse and likely to get worse because of COVID. That really it is still true that only about 10% of people who have a substance use disorder are able to receive the care they need. So that's one epidemic we've been living and working in for a long time. I'm going to talk a little bit now about COVID and how this has impacted everyone. So we now have this novel coronavirus that has really completely overhauled how we live, how we work, how we socialize, has caused over 300,000 deaths nationwide, and has changed the way we have reduced our socialization. Many of us are working at home. Our hospitals are overrun. People are scared. The economic impact, we've only started to see. The impact on cities, businesses, families is extreme, and our future really is quite uncertain. And plus, the virus and our country's response to it has really become somewhat political and divisive, which has caused additional stress on all of us. So this has been very challenging and deadly for all of us. So I remember when I heard this, and it makes sense, but the often quoted number is that 40% of United States adults are now struggling with mental health or substance use. And this makes sense, but it is very, very sad. This is definitely the case. When you look at these numbers, the depression number is about 4 times higher than last year. Anxiety is 3 times higher than last year. And serious thoughts of suicide is about double what it was last year. And as we talk about racial disparities, I'll talk about this a little bit too, because a lot of these numbers are actually highest among Latinx individuals. So the rates of anxiety, depression in that community are around 40%. The COVID-related traumatic stress is 35%. 22% increase in using substances to cope, and among Latinx folks, almost 20% seriously considering suicide in the past month. So it's had an unbelievable impact on many, including people, and particularly people who have been historically marginalized. So when we think about COVID and substance use, so now all of these kind of coming together, we know that alcohol and drug use have significantly increased due to COVID, using drugs and alcohol to cope. And the consequences, of course, of that being overdoses. So overdoses increased up to 42% a month during the pandemic compared to 2019. So many more people need treatment, and in the midst of that, some treatment programs are really struggling to keep their doors open because of increased expenses, fears of exposure, not knowing how to handle this major health threat in the context of people withdrawing from drugs and alcohol. And there was an article, did I mention? I don't think I did. The Washington Post article yesterday that said, we're really only beginning to see the impact of the COVID pandemic on addiction. It's likely to continue rising as time goes on, and the economic impact really affects people as well. So how are our patients in the context of COVID? This is from a study that was done by Omni Institute that had 534 participants, and this was in April and May of this year. And I should mention that most of the participants, all the participants in this study, had received addiction treatment services. So this was people who were able to access specialized addiction treatment. So most of this sample was white, Most of them were living in a sober living environment after treatment, had high levels of recovery capital. 95% of them were sober. So this is a very specific sample of folks, people who can access treatment. But even among them, as you can see there, they had difficulty accessing providers and receiving their medications. They had challenges in the adjustment to the telehealth platform of services. Their sobriety was challenged. You know, people in recovery at this time, particularly people new in recovery, having to attend 12-step groups and all of their treatment services online has, it's not been helpful for, you know, we talk about addiction as a disease of isolation, and we're not able to provide the community and the connection and the therapeutic alliance as well as we usually are when we're not experiencing this COVID crisis. So even among this, you know, kind of privileged sample, people are really struggling with staying sober. And then how about the impact on treatment providers? So this was a study that was done by NAATP in August and September of this year, and there were 165 organizations that provided data on this. And as you can see, a quarter of them have had to close programs or facilities. They have decreased, 66% had decreased revenue, reduced admissions, difficulty keeping people in treatment. There were furloughs of staff. And then about telehealth. So, you know, almost all providers now have had to add or enhance their telehealth services without necessarily knowing exactly how to do that. A lot of treatment providers have had to, like individual counselors, having to learn new technologies very quickly, almost overnight. You know, 44% of these providers were conducting more than half of their services virtually. And this being very new to some providers. And, you know, it's a struggle with telehealth to feel connected to, you know, one's patients when you're on a Zoom platform, for example. One thing that I know about is treatment providers who have been seeing people in their home environments and been seeing more of the impact of trauma, of, you know, how these families and individuals are being affected, and seeing things that providers don't necessarily see all the time by seeing the home environment. And then as far as self-care, you know, the last thing I think a lot of providers want to do when they go home from work is to then do a therapy session of their own with their therapist on Zoom. So this has been a great challenge for treatment providers. So we know, what's the next slide? Oh, this just kind of showed, I think at the bottom, you can see, you know, has your staff displayed greater burnout? You know, almost everybody has, and burnout really is a significant problem already in addiction counseling. We know that the average that a counselor, an addiction treatment counselor, stays in the field is about 2 to 3 years. And, you know, providers and counselors have their own concerns for their own health and the health of their families, and they risk exposure coming to work. You know, people with substance use disorders that are coming in for treatment may not even know if they've been exposed. They're coming in sick and traumatized, and you know, having providers have to deal with the vicarious traumatization from their patients, and then on top of that, deal with decreased funding and resources available to them. They're being spread thinner and thinner, and this is really having a major impact on providers. So we know that COVID is really impacting people's substance use and mental health, and it goes the other way too, substance use impacting mortality from COVID and the consequences of COVID. So we know that substance use and substance use disorders really impact susceptibility and risk for getting COVID and for having more negative consequences. I don't have this data up there, but from a 2020 study looking at the death rates of COVID patients with substance use disorders. So if you think about in general, death from COVID in the United States, the average is about, it's between 2 and 6% reported over the months. Now it's back down to about 2% mortality from COVID. But for people with substance use disorders, that range has been 8 to 13% mortality. And there are some racial disparities there in that the 8% was for Caucasians and 13% was for African Americans. So, and why is this? Why are people with substance use disorders having more negative consequences due to COVID? Well, here's a list of contributing factors to COVID, which people with substance use disorders typically have. Few social supports, pre-existing medical issues, a trauma history, a mental illness, being exposed to a lot of mortality due to COVID or substance use or whatever this trauma that people experience, lack of access to healthcare, and of course, ongoing stressors such as occupational financial strain. And this brings me to our next topic about racial disparities. So, you know, when you look at that list of contributing factors to COVID, unfortunately, those are also true of people from historically marginalized communities with racial and ethnic minorities. Also have often an extensive trauma history and intergenerational trauma, being exposed directly to mortality in their daily lives and having lack of access to healthcare and ongoing stressors such as occupational and financial strain. So this COVID pandemic has really differentially impacted people from different ethnic groups. So when we look at racial disparity in COVID deaths, so this is updated all the time on the COVID tracking project, and it ranges between, you know, I've seen it up to 2 to 4% higher rates of death for African Americans than for white Americans. And then what's not on there, but if you think of African Americans with, I saw a number of African Americans with a recent opioid use disorder were identified as 4 times more likely to develop COVID-19 than whites with recent opioid use disorder. So there's definitely racial disparities in healthcare in general, and of course in both addiction treatment and in healthcare treatment. It's clear that there's some impact of systemic racism on our healthcare system and in who gets the most help and support. And we'll talk about why these numbers are the way they are in just a bit. So this was from a recent webinar that was held by National Academies of Science that was mental health and substance use disorders in the era of COVID-19 with special focus on the impact of the pandemic on communities of color. And Nora Volkov from NIDA said that COVID has really created, revealed, and exacerbated long-term healthcare inequities due to race and ethnicity. And I thought this quote was particularly impactful. COVID doesn't discriminate, addiction doesn't discriminate, but our society does. And therefore, people from racial and ethnic minority groups often don't receive the kind of health care that others do. Another pandemic, it was called a racism pandemic by Sandra Schulman, who's the president of the American Psychological Association. I just wanted to read her quote. She said, George Floyd, Ahmaud Arbery, Breonna Taylor, Trayvon Martin, the list is far too long and ever growing. The deaths of innocent Black people targeted specifically because of their race are both deeply shocking and shockingly routine. We're living in a racism pandemic, which is taking a heavy psychological toll on our African-American citizens, and the health consequences are dire. I'm going to talk just a little bit about this and I thought calling it a pandemic was helpful because we all are using that word as you know, this widespread illness, and it really is a widespread illness that is affecting people very profoundly. So we've seen images like this, protests like this. This was in New York City in June. And as with other recent years and years over time, the rate of fatal police shootings among Black Americans is much higher than that for any other ethnicity. And this year, awareness of that rose, particularly among white Americans. African Americans have known this for a long time, all too well. And it really came to be part of the public discourse this year, particularly around the death of George Floyd. The impact of this, it seemed like there was a peak of discourse on this topic, and it's already started to reduce among the mainstream media and things that and we just can't let this fade from our public discourse. This the impact of racism in every area of our lives, and including our physical and emotional health of our communities, it's so profound that we really just can't let this this increased awareness fade away. So summing up systemic racism is a challenge, and I admit this is not my area of expertise, but in the past few months, it has been, I've been more aware, as many of us have been, of the profound impact of systemic racism on every area of our society. And so, I thought was a helpful summary of institutional or systemic racism, as opposed to like the interpersonal racism that people experience from person to person. This is things that are ingrained in our system. And so, this is talking about how, for example, there's housing discrimination, and, even among people from different race and ethnicity groups who have similar incomes, there's still a lot of ingrained housing discrimination that makes segregation persist. And so there's segregation among where people live, and people from historically marginalized groups are more frequently living in poverty-stricken areas with less access to high-quality education and healthcare. Then there's bias in the education system, where children from minority groups are not as commonly directed to higher education, and they're also more susceptible to discipline in the education system. And then, as we know about the criminal justice system, they're more susceptible to arrest and incarceration. So, people from racial and ethnic minorities tend to have difficulty accumulating wealth, even if they start with similar resources, which they often do not. So when we think about this kind of systemic problem in terms of COVID, so this is just a way in which there's systemic racism affecting who gets care and treatment and the best services for COVID. As I mentioned, the racial and ethnic minorities have a higher death rate from COVID. They have a higher rate of economic challenges as a result of COVID. And as I mentioned, they tend to have higher mental health consequences of COVID. Looking here again, housing discrimination and unequal educational opportunities, leading to less access to educational resources, more likelihood of being a frontline worker who's still needing to work in person, and then higher exposure combined with the stressors of dealing with lifelong racism. All of this kind of comes together to cause disproportionate rates of death. And so, I also saw around the mental health, there was a report from NAMI, the National Alliance for Mental Illness. Oh my gosh, I don't remember what the A stands for. But they listed some barriers that prevent racial and ethnic minorities from receiving appropriate care. So one is availability, lack of transportation, childcare, difficulty taking time off work, a high level of mental health stigma in minority populations, And then a mental health system that is an addiction treatment system that is weighted heavily toward non-minority values and norms. Experiencing racism and bias and discrimination within the treatment setting often turns people away. Language barriers, insufficient number of providers who speak different languages than English, and lack of health insurance coverage is true for people in racial and ethnic minority groups. So all of this combines into a system that is not supportive of the health of all of us. So then when we think about substance use disorders, so as that quote from the Dr. Volkov at NIDA said, you know, both COVID and also addiction have the way we treat both of those have revealed these disparities with respect to race that and ethnicity that need to be addressed. So when we think about you know, our country's response to substance use disorders over the past 50 years, when we just think about the impact of the war on drugs, which the consequences of which, of course, overcrowded jails and prisons and favored punishment, incarceration over treatment, particularly for African Americans and people from other racial and ethnic minority groups. So this really perpetuated cycles of economic and social instability and racism. Of course, in general, you know, 6 million people with substance use disorders in jails and prisons compared to 2.3 million who get treatment. There's often a lot said about the systemic racism that's clearly evident in the criminal justice system. You know, illicit drug use in the past month, this was from 2013, but they didn't have the exact same things in 2019 report, but they had similar use numbers that, you know, when you just look at white and Black Americans, the numbers of percentages of those groups that use illicit drugs and that have substance use disorders is very similar. But when you look at drug-related arrests, for example, you know, it's over, you know, it's like 2.5 times that for white Americans as it is for Black Americans. So, you know, really, although rates of drug use and substance use disorders at least among Black, Latinx, and white individuals are similar, they're higher for Native Americans and some other groups. People of color are disproportionately criminalized, leading to mass incarceration of people of color, specifically related to substance misuse, without providing them equal access to quality treatment services. So it's clear that systemic racism profoundly affects how we provide addiction care and how we deal with addiction for different people with different backgrounds in our country. So how do we move forward? How do we promote racial justice in addiction healthcare? Let's see what time we are. Okay, good. So, you know, NAATP, when I started there in April of this year. And so, you know, originally the focus of my work was to be on developing a national outcomes measurement program. So measuring addiction treatment outcomes across our provider members. And very quickly, I was refocused on looking at COVID and how are people being impacted by COVID? How is COVID affecting substance use and treatment? You know, doing a lot of work around that to try to help our members get, you know, PPE and get, you know, government grants and things. And then, you know, as the racial kind of crisis came to a high point this year, we started looking in more detail at diversity and equity and inclusivity. And so we've done a lot of work in that area recently, which we need to and is long overdue. You know, someone pointed out to us, our board we have one African American member that was recently added and otherwise is all white. And so, you know, how are we to know how to, we need to learn how to promote racial justice in addiction healthcare, because as I mentioned, there's too much, you know, just painful disparities that in this system that we need to help our members with to
Hey,
overcome.
Annie, we have a question.
Oh, we do.
Ready to field a question?
Okay. Yes.
Okay, this is from Frank, and he said, obviously, economics lack of access cause lower treatment numbers for people of color. This is clearly visible in treatment facilities. Can you recommend any policy, quotas, scholarships that treatment centers might enact to increase percentages of addiction treatment available to vulnerable populations?
Wow, Frank, that is quite a question. I might have to think about that to some extent. You know, there's so many reasons why, particularly in members of NAATP, who a lot of them are accept a lot of insurance and do not take Medicaid, for example. That the proportion of white versus people of color in those treatment programs is, you know, it looks very white. And so there's so much that goes into that, it really is a challenge to figure out how do we support more people of color in specialized addiction treatment programs. And certainly money is an issue, you know, needing to you know, the levels of rates of having insurance among people of color is lower. And so they often can't access treatment. And, you know, do I know of any specific organizations or grants that fund people of color to go to addiction treatment? I do not. I hope those exist. And, you know, I think that's one of the things we need to do is we need to figure out how to help people be able to afford specialized addiction treatment, you know, how to get them insurance, you know, widespread healthcare insurance, national healthcare insurance, it would do wonders because, you know, right now when people have Medicaid, they can't access residential treatment, at least currently. They will be able to, we hope, soon. They are treated more in the public treatment system rather than the private addiction treatment system, where evidence-based practices are much more commonly used. People of color are often given medication rather than more extensive services. So there really is a lot that goes into the question of why people of color are underrepresented in specialty addiction healthcare. So we do have a lot of work to do.
Yeah. Thank you for that. He kind of has a follow-up question with, should we be supporting a national healthcare schemes to support equal access to addiction treatment?
Should we support national healthcare
schemes?
Well, I think national healthcare, absolutely. You know, I don't want to speak necessarily for NAATP as a whole, but, you know, I will say that we do believe that having access to healthcare is one of the primary ways that people are able to access treatment. So however that happens, increasing insurance coverage for all will absolutely help people get more care they need. So
perfect. Thank you, Annie.
Absolutely. So what can we do? This was you know, one of our members sent me an article, sent all of us at NAATP an article called it was an anti-racist framework in addiction treatment, and the subtitle was "Addiction Doesn't Discriminate, But Do We?" And this was a really impactful article, and the right authors, Matsuzaka and Knapp, we talked to and asked them, would you join us in developing a advisory group for NAATP on anti-racism and on diversity and equity and inclusion. And so they were extremely helpful in that respect. But this article talked about racism being, it's a persistent source of stress for people of color in the United States, coping daily with race-based stigma and discrimination that has become almost a normative experience, unfortunately. And while, explicit forms of racial discrimination aren't accepted as much anymore, and at least in certain settings, the more aversive or implicit racism that impacts our systems and is still incredibly pervasive. And the article talks about, it says, due to studies of implicit bias, if you've never taken the implicit association test, it's amazing. You can take it for free online, and it looks at your implicit or unconscious associations, for example, between people of color and violence, or drugs, or and versus white people. And the rate that this article talked about was 76% of white individuals possessing an implicit bias toward people of color. It doesn't mean they necessarily act from that, but having that implicitly, and an implicit preference for white identities. So this often leads to racial microaggressions. So those are microaggressions. If you haven't heard that term, it's defined as a brief everyday exchange that sends denigrating messages to people of color because they belong to a racial minority group. So even if there's not as much explicit racism, which absolutely still exists, but even if we're not explicitly racist, or we may be unintentionally doing this, but through microaggressions that we may not even be aware of, often aren't aware of, but that doesn't excuse them. So, this article talks about how substance use treatment as an industry is deeply influenced by systemic racism in all areas. So in treatment access, in treatment retention, staying in treatment, and in the outcomes of treatment. So just briefly, a little bit about that. So people of color may delay seeking services because of economic barriers. And when they come to treatment, they sometimes have more severe consequences as a result. They may not stay in treatment because, as we mentioned, in some settings, specialized treatment, there's no one that looks like them. The interventions that are being used may be not culturally sensitive. Again, maybe not intentionally. There are lots of microaggressions. The therapeutic alliance, as we know, being the most healing factor, in that alliance, there's a need to address the really relevant cultural factors and racism for people of color. And that often isn't, there's sort of a colorblind approach. Oftentimes that when we're not aware of this and we have the privilege of not having experienced a lot of racism, we unintentionally downplay that as an important factor in the person's mental health and substance use. And so people end up leaving treatment oftentimes because of those things. And they may, Black and Latinx clients are more likely to report unfavorable substance use disorder treatment experiences and leave treatment earlier. And then after treatment, there may be poorer outcomes, but when you're considering, treatment, it is not differentially effective if we are providing culturally sensitive services that people of color can benefit significantly, just like white people, from treatment services, if they are provided in a culturally sensitive manner that addresses the impact of racism. So if you haven't read that article, it's wonderful. So it's really helpful in creating kind of a framework for how to move forward. And as a result, as I mentioned, we developed NAATP developed a DEI, or diversity, equity, inclusivity advisory group, because we realized, with who's in our staff and leadership, that we don't have as much diversity within NAATP, and we need support. So we now have 19 behavioral health leaders who are in our advisory group. And in our first meeting, which was in August, we asked them what do they believe most needed to be changed in the field? If they could change one thing, kind of the miracle question. Three themes came out, and we kind of talked about them here, in one in each category. It just kind of happened that way. But one that came up over and over was the lack of diversity in the workforce, and particularly in leadership and addiction treatment. And so diversity, both in our client base and in our workforce. So needing to, have diverse faces and voices, and include diversity in because if we include it in our workforce, then that's going to be more, people will feel like, people of color may feel like, I know, here's someone who looks like me, and maybe I can relate to. So that was one, the lack of diversity in the workforce. Two was, of course, the lack of access to care, and the different stigmas, the challenge of outreach to diverse communities, to really discuss substance use and mental health in a way that people can relate to, and making sure everybody has the same opportunities to access care, including increased access to health insurance. And then the third one was inclusivity. So how do we create, we don't have an addiction treatment system in some respects that really facilitates particularly people of color being engaged in treatment. And of course, staff retention, people with diverse backgrounds wanting to work where they work, and feeling comfortable where they work. So those three topics we now have some subcommittees. Everyone loves committees. So, but these, it's been such a treat to work with these providers, these leaders in behavioral health, and have these discussions. And one of them said the other day, like they said, I've been waiting for decades to have this conversation, about how do we change addiction treatment to be more supportive of diversity. So we've tried to look at efforts in each of these areas to see, how can we move forward? Our efforts in the coming year, we have a work plan for DEI. We're going to have as far as diversity, a webinar on health, human resources practices for increasing diversity among staff. I'll talk about the Colors of Recovery podcast in a minute, but we also would like to initiate a mentorship program for people of color to stay in the field, to feel that it's a valuable field to work in, and that trying to attract more people of color to the field. And then with respect to equity, I'll talk about the outcomes and measures program that we're doing. We really need hard data to demonstrate the lack of equity, so that specifically in specialized addiction treatment programs, you may have noticed we don't tend to collect data in the same way, and we need to, in order to demonstrate the disparities and help us understand, what kind of treatment works for whom, and how do we get it for more people. And then inclusivity, so people really being heard and listened to and a part of, whether they're in the workplace or in a treatment environment. We need to make some significant changes to improve inclusivity in both of those environments. So the Colors of Recovery just launched, and you can find it on our website. This is Tanya Bhattacharya, who's been instrumental in starting this with another one of our advisory group members, Zena Rodriguez. And there's these short videos that they're just 3 or 4 minutes about, and they said representation matters, and we need to show our faces, hear our voices. And that by diversifying our workforce, as it's, she says there, I just can't say it any better than she said it. Our world will continue to heal if we really dive into these issues. So those stories are beautiful and they're short, so easy to consume. So check out our website. They have decided, Dina and Tanya, to do a podcast. So on racism and anti-racist efforts and diversity in addiction treatment, and what it's like to recover as a person of color and what it's like to work in recovery as a person of color. So keep your eyes peeled for that. And then our outcomes program, you might say, how can outcomes measurement improve equity? Well, what we need is among treatment providers, we need to measure some similar things, and we do to some extent, but we need a database, a centralized database that will allow us to look at demographics, social determinants of health, and outcomes of patients across providers. And then to learn from that database what people with what background benefits most from which types of treatment, to demonstrate that we don't just want to have people of color getting MAT versus specialized residential addiction treatment. We want to demonstrate the value of different kinds of interventions for different people. And that can really help us to inform payers and policymakers to advocate for improved equity and access, and hopefully get more people the services they need. So it's a little complicated in thinking about this, but we need the data to demonstrate that there's inequity that needs to be righted. So we're talking to providers now, trying to help them become part of this so that we can do this research together. And then finally, the inclusivity piece, based on that article I mentioned, they talked a lot about the staff training that's required to build racial consciousness, not have a colorblind approach, protect clients against microaggressions, look at assessment differently, really closely assessing experiences related to racial identity and the impact of racism on substance use and mental health. And then how we do treatment differently, what kinds of different interventions we need to do that are culturally consistent. So keep an eye out for our webinars and our trainings and our podcasts. We're really trying to bring diverse voices to the table so we can all figure out together, collaborating together to figure out how to address this systemic problem we have that denies people access to high quality care. So in summary, this has been a whirlwind to present. There's so much to talk about. We're all living in the midst of crisis right now, social crisis, health crisis, racial crisis, economic crisis, emotional crisis. And the toll of each of these pandemics is going to continue to unfold, unfortunately, particularly in historically marginalized communities. There's been so many great resources that have become, I think, more, people have become more aware of them recently. How to Be an Anti-Racist by Ibram Kendi. He mentions there, the only way to undo racism is consistently identify it, describe it, and dismantle it. First we have to have the conversations. We have to have the uncomfortable conversations. That's what our DEI group was saying. We're going to have some uncomfortable conversations in this process, but we need to bring awareness to this problem and then act to dismantle it. Another one of our members of the DEI committee said, well, DEI is kind of becoming a buzzword. He said, diversity is about facts, inclusivity is a behavior, and equity is an investment. And in order to change, we need to change facts, behaviors, and investment. to do all of that, we need to work together. We need to listen to diverse voices, and we need to stay focused on this issue and not let it fade away, because it invades everything we do and impacts even how we stay well from pandemics such as COVID and longstanding epidemics, pandemics like racism and substance use disorders. So, thank you. I think we'll probably have time for a couple questions. There's our DEI resource page, which links to a lot of other organizations' DEI resources pages, because there's so much out there that's helpful to learn more. Our outcomes program, there's a participation form we put there as well, because we're trying to get as many providers to help us in this effort. And there isn't a charge to become part of that program. So I hope this was helpful or interesting. We certainly are in a unique time. So Christy, what do we got?
Hi. So I'm going to give everybody just a second here to type some questions if they have any. I just want to say thank you, Annie, because that was a great presentation talking about issues and topics that have needed a voice behind them for a very long time. So I think this is kind of the beginning of a much bigger shift, and hopefully with everybody working together, we can certainly start addressing these on a healthier, productive level. So if anybody has any questions, let's go ahead and get them typed up. I'm getting an awful lot of thank yous. I know a lot of people, everybody enjoyed this presentation. Again, just want to remind everybody that this is recorded. It will go up on the website on Friday. If you have any questions, feel free to reach out to Annie. She's happy to answer all those. And let's see.
I'll say one thing, and I noticed that I know the Frank who asked this question. Hello.
Yes, you do, Frank.
It made me think of the Drug Policy Alliance, to learn more, their website, their services, what they do around the dialogue of what needs to change in policy to undo the problems from the war on drugs. And their website is wonderful in learning more about that. So that might be a way to look at the kinds of policies that we should support, that we should advocate for, to really bring addiction treatment to vulnerable populations. So thank you for your question. And that made me think of them. So thought I'd mention.
Awesome. I think we are good to go. Again, everybody, thank you so much for your continued support of the webinar series. We love doing these. We have a great year coming up for you in 2021. And again, appreciate all your feedback. We hope you and your family have a safe and healthy holiday. Annie,
yes,
thank you.
Thank you.
And I look forward to hearing more, and definitely check out NAATP's website. Great resource and great information. So please be sure to check that out. And we will see you all next month. January's webinar will be talking about acceptance and commitment therapy. So stay tuned. That information should be coming to you early next week. If you have any questions, reach out to myself about the webinar. About this particular webinar, reach out to Annie. She's the one. So thanks, everybody, and we'll see you next month. Bye.
Bye.